Go ahead and slip your shoe off for me. Doesn't matter which one.
No judging people.
No judging. So from now on, we need everybody to wash your feet and trim your toenails. Okay? Because your family here is going to be pushing on your feet. When we get into the knee, we're going to need more, or ankle is okay, but as we get to the knee, we need you to wear sweats most days so that you can take those sweats off in class, just short of, frostbite, and be able to get to people's knees so we can examine the knees. So just be thinking about that as we start doing these evals, and that's part of coming to class ready to go. So what we have here is the first, let's just go down the list. So we've got the first MTP joint. That is what that says, right?
Yes.
From here, it looks like it says second, but I know that it says first because I don't care about the second one.
It says
so,
first.
So this is my first MTP joint, right? So this is my phalange right here. This is my IP joint. My first MTP joint is right there. So if I play with that, right, I can feel and use my imagination a little bit. There's a line that goes right through there, right? And I can play with that joint right there. That's my first MTP joint. So on lab, if I asked you to palpate that, what I'm looking for is for you guys to feel around. If I say first MTP joint and you're up here, you got no shot. But if you come down here, and it's happened before, and people get confused and you're nervous and you're like, first MTP joint, just saying, it's happened. And I'll be, hey, I usually have another drink of coffee. Okay, so play around with it there that you know that you're on that. So what's my next one up there?
Sesamoids.
My sesamoids. My sesamoid bones are going to be sitting just underneath that. So if you're asked to palpate those sesamoid bones, find the joint. Sesamoid bones are sitting right there. I don't expect you to go, yep, that's the lateral one and that's the medial one, yep. We know they're there, okay? We know that those two bones are there. What that does is line up my flexors. Flex down for me. And so those are ideally there to help line up my flexors to come out and insert out here on the distal phalanx right there and pull my toe down, okay? So first MTP joint, sesamoid bones.
Fifth MTP joint.
Fifth MTP joint. I'm gonna come out here and this little piggy went to the market. And right there is the fifth MTP joint. I don't want you guys, I'd rather you not go here. Here. It's right there. I want you to get in here and just get nasty. Get in there and dig in there. Get in here and dig in here. Oh, yep, that's it. Make sure that you got your finger on it and you say, oh, yep, that's it right there. Bang. Okay? And say all that and go Cougs. What's the next one?
Base of the fifth.
Base of the fifth. So I'm going to go from my fifth MTP joint. I'm going to go all the way out to, now another way that I know you're on the base of the fifth is you say, that peroneus brevis hooks in there. So I need you to evert your foot like this and hold. I'm going to follow that. Bang, base of the fifth. Okay? So I know that my peroneus brevis is going to come around here and then it kind of juts out a little bit. My cuboid is going to be sitting right up there, right? And there's the base of my fifth right there. So if you evert that foot, that peroneus brevis is sitting right here. What's my next one?
Metatarsal head.
Oh, okay, so my metatarsal heads. Now, when you do your real time, you're going to start with pull foot back. So see my tibialis anterior right here? I'm going to get away from my extensor hallucis. Pull your foot back again. So right there is going to be my tibialis anterior right there. So as this tibialis anterior comes down here like that, right? Right there, here's my flexor right there. Flexor hallucis. That's my end spot right there. So I'm going to go right there. I'm going to split that tendon and I know I'm on the navicular bone. So see how I made an N there? Use your imagination. Okay, right there. So that is going to be my navicular bone. Now, as I come down medially, I'm going to palpate that. That thing's a big old bone sitting right there, right? It sits all there like that, and so I'm going to palpate on that. Anytime you're palpating the foot, you can't miss that. Then I'm going to move from my navicular to my first my third cuneiform. They should line up. My first one lines up with 1. My second one lines up with 2. My third one lines up with 3. Remember, we said that kind of keyholes back in there. Imagination, right? And then 3 and 4, I've got my cuboid sitting out here, lateral most cuneiform. I mean tarsal bone. It's not the cuneiform, it's lateral most tarsal bone. And then I'm on the base of the 5th. What was I finding to begin with?
Metatarsal head.
Oh, then I'm going to move my way out here to the 5th and to the 4th and to the 3rd. That 3rd is going to be a little bit more prominent. And then I'm going to move to the 2nd, and then I'm going to move to the 1st. Okay? That's my sequencing I want you to how you want to palpate. So move from your navicular, 1st, 2nd, 3rd cuneiform, cuboid, base of the 5th, to the 5th metatarsal head, 4th, 3rd, and while I'm palpating that, I can use this right here. I can apply axial compression back up that bone and do long bone compression. See that right there? Mm-hmm. Feels good, doesn't it? No, it doesn't. What's my next one?
Metatarsal shafts and base.
No, we did that. Cuneiforms first.
And then, so we did find the end spot, right? So how do I want you to find that? You're going to pull foot back into dorsiflexion. If all you do is find the tibialis anterior, I'm fine with that. And then just split that. You're going to split those two together, right? We've got the extensor hallucis right here. We've got tibialis anterior right here. Just split it. Now, what you can't do, what I don't want to see you guys do is pull foot back, and then you push this way. Because what are you pushing on this way? In other words, I'm pushing back that way.
That's talus.
Yeah, I'm pushing into the ankle joint, talocrural joint. I've got to push this way. I've got to push down. So pull foot back, and I'm going to push down this way. That's where my navicular is. It's not that way, it's this way. Okay? You got to go down like that. Split them, and yeah, you want to go right on the, what do we call that? Dorsum of the foot, dorsal side. And then there's my navicular bone right there. It goes all the way down to the side there. So I know I'm on that bone. Then I want you to go from the navicular to the 1st cuneiform and to the 2nd cuneiform. Now you have to use a little bit of, okay, this is what it looks like in the book. So in your mind, you're peeling that skin back and you know where it lives. This is a good starting point for you. You know just distal to it, you're going to be on the cuneiform. And then the 2nd cuneiform, and then the 3rd. And you know the cuboid sits right there, base of the 5th. Okay? All right? So, what I can do, and I'm getting a little ahead of myself here now, is this is going to form, what is this joint right here? It's my tarso-metatarsal joint or my Lisfranc. I can do a tarso-metatarsal glide right there. Maybe a little, her foot is small enough. If I've got some big lineman, you know, I'm like, ugh, you know? But with her foot, it's easy to, you know, do my manipulations, and I can go there. If they're sore right here with a mechanism of axial compression, she landed like this, okay? And she's swollen all the way across the top of her foot. Mechanism, keep in mind the mechanism. What do we say is the most important thing when you do an eval? You've got to know onset, mechanism of injury, functional anatomy. So if my foot went like that, I know what those forces were. I know where they're hurting. That's what I think it is. Even if you're no good at doing a tarso-metatarsal glide and you're thinking, well, I don't know if that's loose or not, but they're sore where it is, you're going to end up going to the doctor. They'll do stress x-rays. They'll probably put their foot in like this. Even in eval, they'll want to know, does that hurt you right there? Big and inflamed, it's kind of a no-brainer, okay? All right, so I can do tarso-metatarsal glide. So navicular, 1st cuneiform, 2nd, 3rd, cuboid, base of the 5th. What some more I got to do there?
Sextum tali, sinus tarsi, peroneal tubercle.
Cool. Okay, so let's see. We've got the peroneal tubercle, right? We know that's on the lateral side. I put my thumbnail on her lateral malleolus. IP length, that's going to be my peroneal tubercle. Okay? Now, I have her evert. She pulls out here. You can see her brevis is going to come right through there. Okay? Some people it sticks out a little bit more than others. And so you have them push out like that, boom, you can see that tendon go just like that. You're on the peroneal tubercle. Opposite of that, sustentaculum tali, I've got my thumb, I'm going straight down IP length. Right there is going to be my sustentaculum tali. Now what I want you guys to do is to feel for that, and then there's a little indentation right here. Here's my navicular bone, my navicular tubercle, sustentaculum tali. You put your thumb right in there, spring ligament, calcaneonavicular spring. So I don't expect you guys, okay, you come in and I say, you're going to have 3 bony palpations and you're going to have 3 soft tissue palpations, and I give you spring ligament. It's here. I want to see that you know, yeah, it's here. It's here. We know that. It's over here, right? Well, I want to put my thumb here, put my thumb there, feeling that little indentation. Be specific, okay? Be more specific. Don't just right there. Okay, next question. Okay? I want you to get in there and dig. So we did peroneal tubercle, we did calcaneal tubercle, which is going to be just my calcaneus sitting out here. We won't do much with that. Medial malleolus, bang.
Bang. Bang.
Bang, right there. Lateral malleolus, right there. Bang.
Flexor hallucis.
Okay. So my flexor, I call that hallucis. So we're going to pull back right there. Okay, that's my extensor, excuse me. Flexor, pull down. Now that one does not stick out like that, right? But we know it comes underneath, and then we can palpate coming back up this way. Main thing is if I'm having pain through this arch, is it my arch, any fascia through there? Is it specifically this spring ligament? How about if I have you flex your toe down, and does that make it hurt? So we can isolate MMT, flexor hallucis. Yeah, and you can, it's usually a little bit sore. Tibialis anterior, we already found that, right? How do I find my tibialis posterior? Now, I'll tell you, when I'm looking for you to find a tendon, a muscle, what do you think I want you to do with that?
Do an action.
Break test the action, right? Whatever it does. If nothing else, if it doesn't pop out, at least I know you know what it does and where it lives. So I want you to find tibialis anterior. They're going to dorsiflex for me, so pull your foot up, resist, bang. Find tibialis posterior. I need you to turn your foot in like this, and don't let me break, okay? And I know it travels right through there. Even though I can't necessarily see it, I know where it's coming through there, okay? Peroneus brevis, turn foot out and hold. We've already found that a couple of times as it goes down to the base of the foot. You see how I want you to do that? Break test it and then palpate where it goes. Achilles tendon, we got that. And then plantar fascia. They are going to have pain with plantar fascia right there. That's usually where it starts. And then it might splay over the medial side, the intermediate side, the lateral side. But you're going to see it more intermediate to medial, okay? But they'll typically, they come in, man, the bottom of my foot is sore. Does it hurt here? Yeah, right there. When I step down in the morning, hurts right there. Plantar fasciitis.
Dorsalis pedis.
Oh, yeah. Okay, so pull both, push back. So if I find this extensor hallucis longus, see where my little dot there is for my Liz Frank? Now relax. That's going to be dorsalis pedis artery. And that's how I want you to find it. Pull back, relax, bang. That's where it is, okay? So always, 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 some people are going to go way up here, some of you are going to go way down here, it's going to be right in the center. So pull that, you find that extensor, you're going to move just lateral to that and you're on it, okay? That's how you find that pulse. The posterior tibial is going to be right back here. So you're going to take your fingers and push. Here's my medial malleolus, kind of push in just like that. I'm going in that direction. You can't push too hard or you're going to do what? You'll occlude the vein or the artery.
ATFL.
Okay, we'll get into the ankle when it's time to get into the ankle. We'll go around all that. So what I want you to do is to get with your